According to a popular proverb, the greatest wealth is health. Some experts say good health is central to human happiness and well-being that contributes significantly to prosperity and wealth and even economic progress, as healthy populations are more productive and live longer. In Nigeria, some analysts maintain that after years of neglect, the health sector has increasingly become a major concern. Available data from the World Health Organization shows that cases of malaria and tuberculosis have since become a burden in Nigeria, recording the highest rate of cases and deaths. High maternal mortality rates and ill-equipped primary health care system, among others, have contributed to public health concerns across the country. The 2018 National Demographic and Health Survey reveals that the country has only achieved coverage for 3% of the Nigerian population. The survey cited poor policy implementation, lack of policy awareness, low government spending on health, and poor evidence-informed decision-making for this low coverage. As a result, some analysts note that Nigeria is far from achieving the Sustainable Development Goal by 2030. However, the health sector is set to receive the much-needed boost as the federal government recently unveiled the Nigerian Health Sector Renewal Investment Initiative. On Tuesday, 12 December 2023, President Bola Tinubu unveiled the initiative, which is committed to achieving universal health coverage by 2030.
I believe that good population health is both a cause as well as a consequence of economic development. I also know that by increasing investment in health, Nigeria will be accelerating its human capital accumulation and development, likely to enhance our productivity for current and future generations. Health is back on the front burner.
How much will these interventions address the challenges in the health sector? This will form the crux of discussions as guests speak to achieving universal health coverage by 2030 shortly.
Yeah, thank you, Abdulsalam, for that background story there. And seated right with us in the studio to discuss the Achieving Universal Health Coverage by 2030 is Dr. Walter Kazadi Mulombo, World Health Organization Country Representative. You are welcome to Good Morning Nigeria.
Morning, thank you.
All right, you're welcome. Also with us here is Eduardo Celades, UNICEF Chief of Health. Thank you very much for coming on Good Morning Nigeria. Good to see you again.
Good morning. Nice to be here.
All right.
Thank you very much.
Good.
Also joining us for the conversation is Dr. Gafar Alawode, an expert in health financing. Many thanks for joining us.
Thank you very much for having me. Good morning.
All right. So let's kickstart our conversation. Achieving universal health coverage by 2030 is a global commitment outlined in SDG goals. You know, that is the Sustainable Development Goals, which aim to ensure that all people have access to quality health care services without facing financial challenges. Now, let me start with Mr. Olayode. What are the major challenges, right, facing Nigeria faces in achieving this universal health by 2030? What are the challenges?
Okay, thank you very much. I think when we're looking at, when we're dissecting the challenges that militate against universal coverage progress, there are a number of them, and they are inherent in the health system building block. But let me start with the financing. The way universal coverage is conceived is that we should be able to expand access to the population, expand access to services, and expand access to, to take care of the substantial proportion of the cost. If you look at this dimension of expansion, the determinant of the expansion is funding, because that's very, very crucial. And when we talk about the funding, we are talking about the public funding, because if you look at most of the countries that have made good progress in universal coverage, it's not about people spending out of pocket, it's about having a pool resources, which Nigeria has not been able to do very well in recent time in terms of the proportion of the funds that are supposed to pull together. The Basic Care Provision Fund is actually doing part of that, but of course, we need to do more. And that is why, in the president's speech, in the new blueprint, effort is on how to accumulate additional resources. But of course, it's not only about volume of resources. How well are you spending the money is very important as well. Because there are some countries that have not spending in terms of per capita spending, like Nigeria, and are achieving better results. So the issue of efficiency of spending that is associated with accountability in terms of how do we ensure that we are getting the value for the money, the area we are spending money on, we are getting the best for. Like, for example, human resources for health, you understand? So in terms of commodity that we are buying, infrastructure and everything. So the issue of volume of resources, how we are spending as well, you understand, which are actually tied to the quality of governance.
Okay.
That we have. Governance, in terms of governance, we don't lack policies. There are a lot of the policy environment is very, very rich.
Yeah.
But what is the institutional capacity at different levels to implement these and get result and provide the necessary oversight? So I would say the issue of governance, issue of finance, issue of accountability are very, very critical in terms of achieving universal coverage.
All right, thank you so much. But I'd like to begin, from the basics, and Dr. Walter is in the right position to answer my question, and that's because the World Health Organization puts universal health coverage as having people, making people have access to full range of quality health services they need when and where they need them without financial hardship. And you have been in Nigeria, and you know where we are, as regards health in this country. And just on Tuesday, the president came up with a new, a renewed drive, or if you like, renewed hope towards the health sector, saying that, it's going to be much better than we used to say. He just spoke about some of the challenges Nigeria has faced. But let's be critical now. Looking at the target of this universal health coverage and looking at where Nigeria stands at the moment, what are the things you think Nigeria needs to get in place?
Thank you for your question. And I would like to piggyback on where Dr. Gafar left. And just mention that what happened on Tuesday is a milestone. It's a big step towards the goal that Nigeria is looking at, because universal health coverage is first and foremost a political decision, but not just a political decision, but on paper, but a political decision that needs to be translated into action, starting with appropriation of the budget required to accelerate health. The whole world is lagging behind in terms of the cost toward reaching the UHC target by 2030, and Nigeria alike. And part of it was the negative impact of COVID-19 pandemic, but also another range of factors. Dr. Gaffer mentioned the need to invest more in health, but also to spend in the right way in health. The global benchmark, for instance, if you look at the countries that are closer to universal health coverage, they are spending over $86 per capita. And most countries in Africa are not yet there.
Where's Nigeria?
Well, it's up to the government to mention it, but from the latest data, we know Nigeria is still somewhere below $20 per capita. But that's not the only issue. It's the way we spend. So when you look at the data available in terms of, you remember the Abuja Declaration, which was an aspiration to spend 15% of the government budget on health. But that's an aspiration. If you look at the way spending are being made, we would expect that to achieve universal coverage, government, the federal, the state would spend 80% of the available budget for health on primary health care level. But when we look at the figures, it's the other way around. So we tend to spend more on tertiary institution. It's good, but we also need to realize that the population, 80% of them, get first-hand access to healthcare at the primary healthcare level. So that's where we need to spend more. And the event on Tuesday was really a right direction, which emphasized the need to reorient health system effort in Nigeria toward primary healthcare. And primary healthcare, not just the care, but also all the conducive environment. We have a very wide network of traditional leaders and religious leaders who are supporting primary healthcare. So we have what it takes. We have generated demand. It's time for that demand to be met by concrete action. And that's the only way Nigeria can expect to reach the universal health coverage target by 2030. It's about acceleration. It's about stopping business as usual. And what happened on Tuesday, it's really a big signal. And like my Director General said, if implemented, it will be a game changer and it will send a ripple effect in Africa and the world.
Thank you very much, Dr. Walter, for that. The primary health care is very important. And that's what you say. And what happened on Tuesday is so vital for this coverage to be achieved. Now let's move on to UNICEF, where Celadis, because I know that UNICEF and WHO are actually assisting Nigeria and Africa generally in achieving this coverage by 2030. And one of the things that you do is the issue of financing and resource mobilization. You facilitate resource mobilization by supporting Nigerian government in securing financial resources for health care. You also help in aligning health investment with national priorities and ensuring efficient use of available resources. Now, I want to find out what specific measures will be taken by UNICEF to support Nigeria, the specific measures that will be taken by UNICEF to support Nigeria in achieving these goals.
Okay, thank you. Thank you very much for that question, and thank you very much again for inviting UNICEF to be here today. I would like to start saying that for us, universal health coverage is a journey, right? So we have a place where we want to go by 2030 and to ensure that all Nigerians have access to the services without financial hardship. So we need to connect the past, what has been until now, with the future. And we have a great leadership at this moment that is very clear on this goal, right? And the Professor Mohamed Ali Patteh and the President trying to move there. I think the most important measure that it's in place now is the discussions around the SWAP. SWAP meaning the sector-wide approach. That basically means...
Sector-wide approach.
Correct.
Okay.
To have one plan, one budget, one results framework, where all the partners, WHO, UNICEF, the different donors, the World Bank, Bill and Melinda Gates, UNICEF, etc., we can come together to support the priorities of the government. Until now, sometimes donors, the donor community or the partners, we have been fragmented, working with different priorities. So we as UNICEF, and this is what we saw on Tuesday, where more than 10 donors and partners, we signed jointly with the governors, with more than 20 governors that they were in the room that day, with President Bola Ahmed Tinubu, we signed that we committed to a compact to really support this agenda. And I think this is quite relevant, because it's first time that all of us were going to be together supporting the same agenda. As well, we as UNICEF, we commit in another two aspects that they are very important for us. One is the work at community level, right? Universal health coverage starts at community level. When you are in a remote community in Sokoto, in Zamfara, in Kebbi, in Kwara, right? You need to have like a community health worker, a CHIEF to be able to access to the services. When your child gets sick with diarrhea, malaria, pneumonia, the main three killers that we have for children under 5, you need someone, right, to go with that, to get access to care. So we commit to support as well community health workers and the work at community level. Something else as well that we believe is very important is the unlocking the value chains, and as well the coordinating Minister of Health and Social Welfare is very clear on that. I was talking just before coming here this morning with one of your colleagues. What is the price now of amoxicillin clavulanic, right? One of the most common antibiotics. Now it costs between 25,000 to 50,000 nairas to get a treatment for a tooth, for teeth, right? So, for example, antibiotic, very, very common. Why? Because it's imported. So we need to move quite strongly to local manufacturing, right, of drugs, medicine, vaccines. And this is something that, as well, the minister is very clear, and we are trying to support the government to see how we can unlock that potential at country level. If Nigeria becomes a global producer of medicines, drugs, syringes, vaccines, this could be a game changer for the health of the population. So we as UNICEF, we are quite excited to this new journey. And we have a lot of things with a lot of constraints as well, with fiscal space, with allocation of resources, with utilization of resources, as Dr. Ghaffar was saying. But we believe, like all of us together, we can really achieve it in the next 7 years.
All right, Celades, thank you so much. You made mention of a very key aspect, and that's the price of pharmaceuticals these days. That's affecting healthcare. And some people have said it's even affecting people more than the ailments, in this country. And just last week, Good Morning Nigeria actually, dealt on that, how we could reduce the price of pharmaceuticals, and some ways that we could do that were actually reeled out on the program. So I'd like to get to you, Dr. Alawade, and I'm going to ask you, because I know that you have followed the health sector, for a long time in this country, and then looking at the Nigeria Health Sector Renewal Investment Initiative, the compact that was signed on Tuesday, you also followed that, critically. So I'd like to ask, what makes this particular initiative by this administration different from all other, programs of government in the past? And then, from your own assessment, do you see this, hitting the target for the health sector in this country?
Okay, thank you very much. I think to start with, there are a number of aspects of the blueprints, health sector development blueprints, that we've not been addressing in the past. To start with, number one is that's unlocking that value chain. This is the first time there will be a deliberate attempt to actually focus on that area, which is very central. Medicine is account for substantial percentage. If at primary care level, commodities account for substantial, more than 70% of the cost of services that you get there. Looking at that, I think is very, very, very important. Then secondly, I think if you look at other aspects, governance, security, and population health and all those, is something that we've been discussing before. But having a compact that brings everybody together, that's number one. The number two aspect is the sector-wide approach. Like Eduardo said earlier on, this is the first time there will be a very deliberate effort to say, okay, we have a common plan, we have to deploy resources, because part of the problem we have in the health system is there is huge fragmentation. There is fragmentation in the management of health system. To start with, one fragmentation area is to know that Nigeria is a decentralized state. We have federal, we have the state, we have the local government, and everything. I think one aspect of the compact, because you see on Tuesday, the chair of the governors forum actually signed a compact as well, Mr. President and the partner. I think the attempt to reduce fragmentation in the health system is a great enabler for us to make a huge progress, because you asked me what is different. This is part of what is different. Maybe in terms of the element of the policy trust, maybe many things are not actually new, but the renewed efforts towards bringing everybody together to sign a compact that we are on the same page, so that we don't have a state where the state already has a plan, and one partner comes, another partner comes, and everything, pulling the state apart and the federal government. So I think an effort towards strengthening the coordination, I think, is a very, very, very important one. That of unlocking the value chain, which we have not been focusing on. We saw what happened during COVID. Most of the country where we get our commodities and everything, there was no opportunity to even export things. And even because of the vaccination, there was we got to know about vaccine nationalism, where every country was actually prioritizing its country. Which makes sense. So I think the attempt to look at, and it's not only about the health benefit, there's a strong economic benefit. India today is the stronghold of pharmaceuticals, because they are able to develop their pharmaceutical effect. It has a lot of implication on creating jobs, improving the economy. And again, you have more control over the quality of what is being produced as well. So I think this overall new policy direction is a huge one, and everybody needs to come together to support it, including the media, because we really have to communicate effectively for different stakeholders to know. Different stakeholders in the sense that health is multisectorial. Because whatever we do in health, if those outside health are not doing their bit, look at water, for instance. What kills children more is diarrhea is one major killer disease. Why do you curb issue of diarrhea? Having potable water. Production of potable water is not within the not within the ambit of the health sector. So we really have to communicate effectively. We really have to engage other sectors as well, including the issue of financing we are talking about. Is not the health sector that determines the amount of money that comes to the health sector. So we have to talk to the Ministry of Finance, Budget Office, the National Assembly. All of us have to be part of this so that we are on the same page in terms of achieving universal coverage by 2030. Thank you.
Okay, thank you very much, Dr. Gafar there. But one thing that Salade said is the issue of community, unlocking the community, getting, to the community level, because that is where, these they suffer this most. And we know that we have great challenges in this country. The issue of not adequate, you don't have adequate manpower, because most of these, our health sector now is, many of them have jackpot, just like, they have traveled. Then the issue of getting access to all these communities as well. So in doing this, what strategies do you think? Because we talked about the issue of policy, that we do not lack in policy, and is the implementation that is actually the problem that we face here. So what strategies do you think that Nigeria needs to employ, you understand, to promote this community engagement?
Okay, let me even start by further underscore the importance of a community engagement. So we can spend all day talking about mobilizing additional resources. We've seen practical example where in some communities people were enrolled on health insurance. And then there's a cohort of people that were enrolled. There was no engagement of the community. We have seen another cohort where people are enrolled. Where people are enrolled on health insurance and the premium paid, it's not they ask them to pay money. Without following up, you discover that they are not using the services. They are not using the services because they don't even know the importance and all those stuff like that. They don't even know it is real because we have been trained not to believe the government system. Whereas where there is a strong community engagement, people that interact with people from time, the enrollee from time to time, we're seeing huge difference, 4 times increase in utilization of it. Coming back to what we need to do.
Because when you see the increase there in the utilization, maybe because the community leaders are being carried along, because they are the one that will actually, encourage and mobilize and galvanize their people towards
that is the point I'm driving at. Where you see improved utilization, there is strong community structure. There is strong community structure in terms of a ward development committee that have been engaged by partners. They are trained, and there is a constant engagement with them in terms of teaching them how to do their work and all those stuff, and then having good leadership at the community level as well. So the structure is there in terms of a blueprint, in terms of what to be done. So I think we have to focus more on it as well in terms of strengthening these people. There are a lot of instances where the ward development committee are there and nobody is actually supervising them, nobody is getting in touch with them and all those stuff to strengthen their capacity. So as part of the package of intervention that we'll be looking at, community has to be prioritized. And the issue of communication is very important. Let me give you an example. There is a common story where people are given bed net in the community to prevent, malaria and everything. And they are using bed net for fishing. And when they ask them, they now discover that these people are not able to establish any connection between mosquito bite and malaria. So I didn't see any need for them to use a mosquito net to prevent malaria. So communication is very, very important. The health workers often think the ordinary people there in the community has the same level of knowledge. No. We have to,
go down to their level.
Go down to their level and listen to them as well.
Yeah.
It's very, very important. It's not just a top-down approach. Listen to them, understand why they are not using it, and have dialogue so that can change behavior.
All right, thank you, Dr. Alawude. Talking about that fishnet, outside education, you already mentioned it's multi-sectoral, dealing with the health sector. It could be, lack of equipment to do their daily business. That could also be an issue. So the average Nigerian is looking for food in his mouth first before he's thinking of any other thing. So, that could be a reason, because if fishing nets were available, for example, there'll be no point using the mosquito nets, right? Okay, so of course,
health is wealth.
Health is wealth, but how many people understand that? For someone who's talking about his health, he first and foremost is thinking about food in his tummy, because if you have food in your tummy, you may even be able to solve some of the health challenges that you would have, later in life.
That is the multi-sectoral approach we are talking about.
Exactly. So, there's so many angles to look at this issue. But I'll get to Dr. Molombo now. You are the World Health Organization country representative right here in Nigeria. And when you were speaking earlier, you talked about the need to strengthen the primary health centers. That's like, starting from the basics. That's where, the health structure needs to be built first before you get to the tertiary level. But like you already mentioned, we see it from the top-down approach kind of thing for us in Nigeria. And with this new initiative, there's an ambitious plan to create, or rather build 17,000 functional public primary healthcare centers, additional to what we already have. But my question is, the primary health centers we already have in this country, some are not functional. Some do not have, qualified health practitioners in them. There's no infrastructure. There's so many issues. So, what would be your own, because you are not in government, so what would be your own advice now on how they should go about this, just so we can strengthen the primary healthcare system in the country?
I think Mr. President was very clear in his determination and decision to really start from the primary healthcare level and boost investment into rebuilding infrastructure. And of course, we have existing primary healthcare, and like you said, not functional. But one of the key advantage, if I may call it like that, or the opportunity of the COVID-19 pandemic, is that it has revealed fractures. And it's not just about infrastructure, it's about the most important people who are manning those infrastructure, the commodities, money to run the infrastructure. So it's a first and foremost a political decision. So most likely Nigeria will need to do a critical analysis to see what is existing and what doesn't, and what needs to be fixed, what is already functional need to be strengthened, but what doesn't exist, there has to be an investment scale to accelerate, not to do business as usual. And this is why reorienting the health system development effort toward primary health care is very, very important. The multi-sector policy action, whole of government approach, whole of society approach, embracing also the advantage of the private sector. We know that in Nigeria more than 60% go to private sector for health care. They also have primary health care. So they will complement the government effort while the government is still building to reach the 17,000+ primary health care. But I would like to emphasize that primary health care is not sick care. It's a comprehensive approach. It does have other pillars. The community empowerment and engagement, so that they could take charge of their own health, their own health issues. They should inform the content of the minimum service package that the government is trying to give to them. We've heard President and the Honorable Coordinating Minister mentioning the rising burden of non-communicable diseases, which in some other countries overtaking communicable disease in terms of number of deaths, hypertension, diabetes, respiratory chronic diseases, and others. And it's very important that cancer screening services, to what extent they are included in the current minimum service package. So rethinking the package itself, it's an important step toward that, and it's only the communities that can better inform the government on those. So I believe there will be more engagement with the communities. Next Monday we are meeting the Northern Traditional Leaders Committee on Primary Healthcare Revitalization. It will be another opportunity to...
But talking about the communities, Dr. Olawode, I think you'll be able to, put perspective to this. I'm a bit worried because, the local government doesn't seem to function in the country. And then these primary health care centers are domiciled, in these local governments and are supposed to be maintained, or if you like, serviced by the local governments. Now, the fact that the local governments are not functional, they're not as effective as they should be. Do you really see this structure of having the primary healthcare centers to working in this country?
I think the policy response to the weakness at the local government is what we call primary care under one roof. If you look at primary care under one roof policy, if you look at what was obtainable before, the management of primary health care was so fragmented. We have Ministry of Health involved. We have the Local Government Service Commission involved. We have the local government themselves involved. We have the state primary care. So it was very difficult to hold anybody accountable. So the policy response now is a primary care under one roof, where you put the management, funding, and accountability of the primary care system under the state primary care board. I think that is making a huge difference in that, because before it was very difficult to hold anybody accountable to what is happening. However, state at different level in terms of implementing the PHC under one roof. And the most difficult bit to implement is the migration of the management of the workforce to the primary care board, which some states have. But what we've discovered that where there is a strong commitment on the part of the governor, it is work. I'll give it to Governor El-Rufai. It worked very well in Kaduna State, where they were able to give the primary care board very, very strong power to be able to recruit, to redistribute, to manage everything. In a situation where, there's weakness in the management of the primary care board, whatever we do, we're not going to get it right. So part of what we advocate for, I hope as part of this compact, the governors will be able to give the primary care board the necessary power and support needed to manage the primary care board and to be able to, there's basic minimum package of service at the primary care level in terms of number of health workers you're supposed to have, distribution and everything. So if there is that political will and leadership and support given to the primary care board to be able to manage effectively, I think it's going to be very important. And one important thing is technology. We have seen in Gombe State where they've deployed biometric attendance tracking, because absenteeism is a huge problem at the primary care level, even at secondary level. So the governor has been able to deploy technology that to be able to reduce absenteeism significantly. And that is part of what I was talking about, efficiency of utilization of resources.
Yeah.
Because there are a number of things that makes the money that you are spending not to show at all. You understand? So I think having a very strong primary care board with support from the governor at the state level is very, very crucial to improving the quality of primary care delivery. And like the WR said, it's not only about the sick care, it's about the comprehensive approach to the primary health care that look at the population health, look at community, look at the communication, and many other things, including other sectors. Like I talk about water. Diarrhea kills children more than any other. Correct me if I'm wrong, Eduardo. But who provide potable water? You have Ministry of Water Resources and everything. So ability to have a multi-sectorial approach to it, I think, is very crucial.
Multi-sectorial approach is very vital.
Absolutely.
Thank you, Dr. Gaffer, for that. Because we have we have raised a lot of issues here. The issues of engaging, the local communities and getting feedback from them is also very vital. And that takes me to the next question, which borders on monitoring and evaluation, because it is very, very vital. Because to support UNICEF and WHO, for us to be able to achieve this, there is need for us to have proper monitoring and evaluation to track the progress towards achieving universal health coverage. And you provide technical expertise and conduct assessment to identify the gaps that recommend based what intervention. Now, my question is, how will UNICEF contribute? How will UNICEF contribute to improving primary health services and ensuring child health care is prioritized in Nigeria universal health coverage efforts?
So I think that that question is very relevant and very relevant on the primary healthcare discussion. Because yesterday I was discussing with Dr. Muji, the new executive director of MPH-CDA, and he was saying no one really knows how many primary healthcare facilities we have in Nigeria. We have estimates, right? Some people say 30,000, 34,000, 40,000, but we need like really the data, the information to really inform what needs to be done, right? How many do we have? How many are functional? We are claiming that we need like at least one primary healthcare fully functional per ward, right? This is the objective, and now it's going to be 2 of them. But how do you define functional, fully functional, 24/7? Which kind of services they need to be always there? So this is the part on monitoring, evaluation, to allow a mutual accountability as well, right? It's like what the government, what the primary healthcare development agency, the boards, the partners, the federal government, what all of us we are committing and how we measure that. So I think that's one of the key questions. The other one is around equity as well. It's not that we are always saying maybe one or 2 PHC per ward, but maybe some wards they need 3. Right? Maybe there are places with difficult access, where a lot of poverty, or maybe we need more functional PHCs, and in others with more easy access, close to a big hospital, maybe it's not needed. So I think as well monitoring and following on the equity. Equity is not the same that equality, right? It's not equal, it's different than equity. So we need to look at that. We as UNICEF, we are, for us, primary healthcare is the cornerstone, right? More than, that more than 80% of the diseases can be prevented and treated at primary health care, including community level. We talk about the main 3 killers that we have in Nigeria for under 5, diarrhea, multisectorial approaches, malaria. Nigeria is the country in the world with more malaria burden, right? We know that maternal mortality is not decreasing. We know that under 5 mortality has decreased, has been improving. But however, we know that neonatal mortality is not decreasing. So the mortality of the babies of 4 weeks, up to 4 weeks, has not decreased in the last 10 years, right? And for that one, you really need to not only to strengthen primary health care, but as well the referral system for the complicated cases. Okay. So this is the type of things that we support. We are committing to go into the swap and to try to target the most vulnerable. At this moment, we are supporting the premiums of 70,000 vulnerable people across 5 states. Right? One of the big issues that we have in the country is that this big out-of-pocket expenditure, more than 70%. So if you look to the overall expenditure in health in Nigeria, 14% comes from the federal government. More than 70% comes from out-of-pocket, right? So this means a huge financial burden for, we know that according to the last statistics of the World Bank, we have more than 80 million poor people. So how they can afford to pay the medicines, the consultations, the safe deliveries that they need. So to us, this is the most critical intervention that we need to address in the next few years, is to expand the vulnerable funds and the equitable funds of the national health insurance, so to ensure that everybody has access to the health insurance, and as well that they use it, as Professor Gafar was saying, right? And as well, this is something that we are working on.
Because you have to monitor the usage as well, because if you have the expansion and the people cannot have access to it, then that's another
nothing is going to change.
Challenge.
So we are optimistic, but still, like we are looking to the new budget, right? 1.3 trillion dollars to the health sector. This is 4.2% of the total budget. It's about $8.6 per person, right? So much more needs to be done, right? And to use it more efficiently. And we know all the constraints on fiscal space, etc. So a lot of the work that is going to be happening in the next few months, actually, is to define how we can use the funds more efficiently.
Okay, Salades, you have made mention of governments, the role of government really in all of this, financing, and then being specific, in areas, talking about the National Health Act and all of that. But I also have some concerns. Government could be committed, to improving the health sector, but I think that like already mentioned, the people have a critical role to play. We're rounding off the conversation, so I'd like you to tell us in what way can the people contribute to the improvement of the health sector in general. They have a critical role to play, because even in some communities where you have functional primary health care centers, they don't patronize them. For example, there's vaccines going around now for young girls. There's a lot of narrative about all of that. A lot of people don't want to take their children for it. There are vaccines for newborns till about 1 year, 3 months in this country, absolutely free in public health centers, but we still have people who do not participate in such programs. So, I mean, how can we get it right, or how can the people, become better in terms of assessing health and doing the needful?
So I see, thank you very much for that, because I see two main issues here, right? One is what we are seeing in misinformation, disinformation, and rumors. And this has been ramping up over the last few months. We saw that with the HPV for young girls, and this is actually has been affecting other vaccines, like the polio vaccination, for example. So we have been seeing a very concerning trend of more people being reluctant to get vaccinated, right? Because they are mixing different messages. So something that the first thing that will appeal to the communities, to the traditional leaders, to our influencers, our media, our journalists, is to be very clear on the facts, right? On how we can respond to misinformation, disinformation, and rumors. We need to be able to track what is happening and to respond with facts, but as well calling to the emotions of people, right? If you care, if you love, if you respect to your communities, to your friends, to your families, you need to vaccinate. The other point is what you said, how we can have a citizenship, communities that they are empowered to really make accountable the government, the health facilities, etc., on quality, high quality services. And actually I'm very happy, because this is one of the indicators that the new government is going to be measuring for health. So when you see the indicators, the KPIs that the minister has, the coordinating minister has, one of them is it's on community engagement and how they monitor the services that they are provided. So I think the role of CSOs, of community, the civil society organizations is going to be key. I think as well the accountability that the communities need to hold accountable to the health facilities is going to be key, and we need to support all this effort. I think meaningful community engagement is the way forward to ensure that the government delivers the services that they are promising to. And we'll be supporting
engagement is vital. Thank you very much, Eduardo, for that. Let me bring in Dr. Walter here, and I want to talk about the issue of policy, guidance, and advocacy, which I think WHO and even UNICEF, they assist, governments of countries to do this, like the policy guidance and to advocate for increased investment in healthcare to achieve the universal health coverage. How are you going about that?
Well, I think what happened last Tuesday is in itself a result of advocacy and policy guidance, because what Nigeria is doing now is a decision that was made at the last World Health Assembly and even in the last UN General Assembly to really reorient health system development and strengthening toward primary health care. And everything we are discussing here, it makes more relevant the primary health care, not just sick care, I have to repeat, a comprehensive approach with multi-sector policy and action, not just health, but going beyond health, but not just the government, also the private sector. We are in an environment where the private sector is offering a lot. So they are also running the health institution. We need to also tap into that advantage. The discussion we are having on monitoring evaluation is an important one. Even the way we measure success. How will success look like in this initiative? Something that has changed to the new blueprint is the focus on outcome and impact. Yes, we have the Basic Health Provision Fund as a mechanism to contribute to acceleration. How many more children have been reached with vaccination as a result? How many more pregnant mothers were attended to by skilled birth attendant as a result? How many more chiefs were able to convey public health measures to counteract misinformation? And what we are seeing is also due to lack of knowledge in communities. Cervical cancer, it hits several years down the road. It will not hit now. So people need to understand that by vaccinating a young girl against HPV, the papillomavirus that is responsible for cervical cancer, they will prevent a lot of cancer in the future. And you know, cancer treatment is very expensive. By doing so, they will save funds to look after other health services. So our role is really to trigger the discourse, to alert authority when things are going wrong, and to make sure that they react, they respond based on their own commitment. WHO is not an organization, separate organization. It's member state organization. It's at the United Nations. So what Professor Pate is pushing for here, under the leadership of the President Bola Tinubu, is in line with the best standard.
Okay.
But what we are after is the services that matters. So we need to measure how many more people are being reached. It's about equity. It's not just we have more health facility functioning. It's about how many people are being reached. A result.
Thank you, Dr. Mulumba. Dr. Alawode, yes. So, you know, I would like you to be brief in answering this question because we're almost out of time. And I would like you to speak to the rising cost of pharmaceuticals. While, as Eduardo Saladis was talking, he talked about, you know, the prices of, you know, drugs and how it's affecting the health sector negatively. You are a Nigerian, and then you know what the issues are. Just on Wednesday, we had the minister on our program, News Extra, and he was talking about the fact that, you know, the challenge in that aspects of the health sector, you know, is beyond the government. All right, local production. We need to get people, you know, in the whole process, in the chain, to be on board, just so that we can have drugs in this country and have, I mean, look inwards and see how we can, you know, produce some of these things ourselves. How can we solve that challenge? I'm asking because looking at the budget for next year, it is still clear that out-of-pocket spending for health will still be high. The budget cannot address, you know, that problem for Nigerians. So how can we solve, you know, this problem of importation of almost every pharmaceutical product that we use in this country? What really is the way out?
Okay, thank you very much. I think there are a couple of things to look at here. So, of course, all countries will have desire to be able to manufacture everything it needs in-house to be able to reduce costs. But there is certain capacity the regulatory agencies needs to have for certain production of local commodity to be to fester. I'm talking about NAFDAC, and a lot of partners have been supporting NAFDAC to reach high level of a pre-qualification so that they will be able to pre-qualify production. That's number one. Number two is that I think if there is a political will, just like we are having now, most of the obstacles that you have that militate against local production of whatever, we can remove them. And I'm very happy is a main policy thrust now for government to be able to face this. And again, I think the issue of resources is very, very important. We have local manufacturers that don't have certain level of financial muscle to be able to. Don't forget that even when they manufacture locally, they must still be importing some of the elements of the outside and all the stuff. So I think we need some financing instrument, like for example what they call blended financing, somebody that may be able to guarantee these local institutions to be able to access some credit, to be able to even produce at scale, because ability to produce at scale too is very, very important. One of the reasons why we are not very competitive is that somebody is producing at scale internationally. You are producing a small amount, and it makes your cost of production to be very, very high. So again, in the past we used to have
due to lack of funding.
Absolutely. Access to funding, like for example, in the past we have a central bank facility that was supposed to be supporting this kind of a thing. I think those are the type of thing we need to accelerate now, in addition to improving the capacity of the
Dr. Lawode, sorry to interject you. In just 20 seconds, how can we bring in private investors, to help in funding this policy?
So in terms of private investors, I think we need a very strong PPP approach in place. And again, create incentive for the private sector to be able to
create incentive. Thank you very much. To cap it up, let's get Dr. Walter your last shot.
I just want to piggyback on the discussion on the local production. We have currently a mission in Nigeria to work with NAFDAC. WHO has worked with NAFDAC to strengthen capacity, and NAFDAC have reached the maturity level 3. And now we are working to get NAFDAC to maturity level 4, and hopefully soon to WHO listing authority. So when we get there, any decision that NAFDAC makes in Nigeria in terms of as a national regulatory authority will be respected in the world the same way we look at the US FDA and others. So it's happening. There are manufacturers in Nigeria who have reached high level of pre-qualification, but they just need to be patronized. But there are also others that can be brought to speed. So we are strengthening Nigeria. It's very important to strengthen national regulatory authority, and I think Nigeria is well poised, I might say, for now. The Yaba lab has reached the level of maturity required for international procurement to start sourcing through them. So it's something that needs to be brought into perspective. It's not just funding, I wanted to say.
All right. Thank you so much, Dr. Walter Kazadi Molumbo. I think would actually end the conversation at this point. So much has been said. Of course, the conversation is a continuous one. We'll continue to talk about it. And of course, as Nigeria looks forward to hitting this milestone, we will, of course, check the progress and, of course, mention the areas that needs to be worked on. Thank you once again, Dr. Walter Kazadi Molumbo, World Health Organization Country Representative right here in Nigeria. Eduardo Salades, UNICEF Chief of Health. Good to have you again on the program. And thank you so much, Dr. Gafar Alawade, expert in health financing. It's a pleasure to have you on the program.
Thank you very much.
All right, so that's our first topic in Nigeria. The society was established to provide a platform for the education of young Muslims in addition to imbibing Islamic knowledge and ethos in the Muslim world as well as in the mosques.
Yeah, this year, 2023, the society is celebrating 100 years of the society's existence. Joining us in the studio to speak further on the 100 years celebration of the society, some may call it centenary celebration, is Imam Abdurrahman Ahmad, National Missionaire of Ansaruddin Society of Nigeria. You're welcome, sir.
Thank you.
Also, in the studio, we have with us Dr. Are Ademola Sani, National President of Ansaruddin Society of Nigeria. You are welcome, sir.
Thank you very much.
All right, still joining us for the conversation is Dr. Adebayo Ibrahim Yusuf, the Deputy President of Ansaruddin Society of Nigeria. We're glad you could join us.
Thank you very much. Good morning.
Okay, so
go ahead.
Let's begin the conversation, and of course this will be directed at the National Mission of Ansaruddin Society of Nigeria, Imam Abdurrahman Ahmed. The Ansaruddin Society of Nigeria is celebrating a centenary celebration. From just taking a look at you, I know that the society is much more older than you. So could you please tell us what informed this society, and who is behind the Ansaruddin Society?
Well, thank you very much. First, I would say that Islam is basically about knowledge. You can't be a good Muslim without knowledge. In fact, the first verse of the Quran to be revealed is about knowledge. It's about reading, it's about exploring, it's about researching, it's about discovery. So in the Nigeria of the 20s, the colonial Nigeria, education, especially Western education, became a tool not only for empowerment of individuals, but also for the development of the country as it was then. Unfortunately, education was brought into this, Western education was brought into this country by the missionaries. And the majority of Muslim children then suffered some disadvantage because they were required to change their names and change their faith before they could access Western education. Then, this was what motivated the founders of Ansaruddin, young people, almost all of them below the age of 30, to resolve to found and fund a Western style school that would not, put the Muslim child at a disadvantage.
Okay.
It was open to Muslims and non-Muslims. So I will say in summary, the motivation for the establishment of the Ansaruddin was to create opportunity for young Muslims who intend to pursue Western education without losing their faith or without having to compromise their faith.
Okay, thank you. Thank you very much there, Missionaire. Dr. Are, besides the issue of education, not wanting the Muslim youth to lose their identity and also losing their faith, what other objectives is Ansaruddin? What are the other objectives of Ansaruddin Society of Nigeria?
Thank you very much. In addition to the issue of education, the propagation of Islamic religion is also paramount in the minds of the founders. And this was also pursued along with the Western education. As they were setting up the primary schools and secondary schools, they also ensured that madrasat, that is, classes to teach Islamic knowledge, were also established. Another intention of the founding fathers was to ensure that the future of this country is not jeopardized, because education is power, education is everything. And consequently, they also ensure that not only Muslim children are given this education, but also other children who are Nigerians, irrespective of your faith or creed or whatever. And I want to believe that that has contributed tremendously to the development of this nation as we have it today.
Okay.
In the political sphere, in the administrative sphere, and in the military, whatever, you found children or top men today who have gone through the Ansaruddin educational system. Okay. And we are grateful to God that the intention of the founding fathers have been met to a certain extent.
Okay.
We are here to continue to ensure that it thrives.
Okay.
I can see the color green, on everyone here, and the white. That's your dress code in the Ansaruddin Society. It's important that people, know that yes, that's what you guys represent, and it's also the color of Nigeria. So it means that you're promoting the country and, of course, the values that we have in this country. So I'd like to get to you, Dr. Adebayo Yusuf. It's been 100 years of this society. Beautiful. I'm sure you have some major achievements you want to talk to us about. And then what has been the challenges over the years, too?
Thank you very much. To add to what the President and the mission have said so far, you see, apart from the mosque and the schools, primary school, Ansaruddin has secondary schools, teacher training colleges, college of education. I said now we have a university at Ofa, which is called Summit University. We improve on the visions and the missions of the founding fathers. Go to our schools, you will discover that our school is at par with other private schools and with minimal fee, so that the less privileged families can benefit from our educations. At the same time, to divert from educations, we also, because Ansaruddin is a society, we have members from across the globe. We have members. There's no state going in Nigeria now that you don't see Ansarudins. We also empower our members, our indigent members. We empower them with the little money that members contributed to make sure that they have tangible living. You know, economic power is very important. Not everybody has a skilled job. So we in Ansarudin will try as much as possible to empower our members so that they can be useful in societies.
But what about the challenges that she asked? What
challenges
are the challenges the society is facing or has faced? And how have you been able to overcome these challenges?
Well, you know, the challenges is enormous. You know, at the time of establishing the society, the economy is not as bad as it is now. And that is why we want to divert from feasibility, because Ansarudin is not being funded by any governmental, it is being funded by members. That is our contribution. So now we want to be having investment that we use to support the mosque and all our institutions. Finance is our challenge.
Okay.
Because members, because we can't depend on members' contributions. So right now we're trying to have investment where we'll be generating money to fund our activities.
Okay. Thank you, Dr. Yusuf, for that. Dr. Yusuf, thank you very much for your contribution. Let's come back to the missionary now, Imam Ahmad. You want to celebrate the 100 years of Ansarudin. What exactly are you celebrating?
Well, if you say celebration, yes, we claim it. It's celebration. It's more of a gratitude and review of progress made so far, and charting a course for the next century. Okay. That's essentially what we set out to do. For instance, it's been 100 years. 100 years. You spoke about green, white, green.
Yeah.
Yeah, it predated Nigeria.
Okay.
That's who we have been, and it's also visionary. I think Nigeria copied us. Okay.
That's interesting.
Yes. But seriously speaking, we are a faith-based organization. As faith-based organization, we have a very important role to play in the development and peaceful coexistence of this country. So we are, the whole issue of celebrating the centenary is focused on exploring ways, of contributing more to this very core and vital area. It is to that extent that we have brought, the program of national dialogue to Abuja. We're based in Lagos. We have always been contributing to national discourse, and we have been very responsible civic members of the society, contributing to our civic duties. You see, for instance, one of the challenges that we have in this country today is the question of, religious harmony.
So how do we promote that?
Okay. That's part of the things we are showcasing. I like to tell you that Ansarudin is proud to showcase some of its educational achievement. And I like to say this in retrospect. The immediate past governor of the central bank, the immediate past, Emefiele is a product of Ansarudin. He actually started his education at the Ansarudin primary school.
Oh, right.
Of course. So nobody required him to change his name or change his faith. And there are so many people
that went through your schools.
That went through our school, and they are making very important contributions to national development right now, across sectors, in the military, in politics, in the industries.
Brilliant. But I'd like to stay with you on that. There's this perception about the Ansarudin society that most of your members are Yorubas. You just mentioned that you're based in Lagos.
Yeah.
So a lot of people, once you mention it, Muslims that are Yorubas are mostly part of the society that get to benefit. Is that true?
No, that's very erroneous. Of course, Emefiele is not Yoruba. The late Bilkisu Yusuf, of course, Bilkisu Yusuf is a veteran journalist. He's once edited the trusts and so on and so forth. Went to the Ansarudin Primary School in Kano. Ansarudin Primary School in Kano. So we have members. In fact, earlier on,
okay, the headquarters is in Lagos.
The headquarters is in Lagos, but we have branches even in the east.
Okay.
As we speak, we have a branch, a masjid, a mosque in Abakaliki. We have in Owerri. We have in Edo, in Auchi to be precise. So it's the fact that we are headquartered in Lagos does not mean that it is, a Yoruba. You can have many Yoruba members, but you have also non-Yoruba members.
Do you have non-Yoruba members at the helms of affairs in Ansarudin?
Yes, at the local level. Because our constitution requires that before you hold certain positions, you have to be residents, in Lagos.
Why?
Now, because then communication was not this easy.
Okay.
You see, unlike now that we're in the digital age, and you can virtually do anything from anywhere.
Okay.
For the progress of the society, for coordination, those who hold offices at the national level are required, to be residents in Lagos. Not necessarily indigenous of Lagos, but residents in Lagos.
Okay, let's move to Dr. Are Ademola. And you have a question for him, because I just want to ask him a question.
Please go ahead.
Okay, I would just want to find out, what is the significant thing that the society will be doing that Nigerians need to know or remember during this your celebration?
Thank you very much. I just want to quickly address an issue just mentioned by the National Missioner, and that is the issue of officers being required to be in Lagos. I think that has changed.
Okay.
Yes, it was done that way in those days when communication was a problem. But as of today, where we have this digital development, you can be anywhere and have conference meetings and all that. The new constitution has now said officers of society, even at the highest level, can come from any part of this country.
Okay.
I just want to make that correction.
Clarification, okay.
Now, two, I must also add that today we are going into the health sector. Already we have clinics, but we are building modern hospitals. As a matter of fact, the deputy governor represented the governor to open one of our top-level health institution in Akoka area of Lagos State.
Okay.
And at Imashayi in Ogun State, we also have standard hospital there. During my tour, during the centenary, I was at Ayekpe, I think in Oshu State, yes. And we have a very, very big hospital also constructed. All this in an effort to ensure that, because government cannot do everything, and we as faith-based organization, we believe we must assist government in reaching our people, especially with the recent efforts of this present administration, where healthcare has been prioritized. We believe we must also assist in that direction. Okay. Now, things that we also, which we are doing but we intend to intensify, is to ensure, yes, you are right to some extent, that majority of members of Ansarudeen are Yoruba people, because probably the mission started right inside the Yoruba territory. But today, we are encouraging our missioners, and that's why things are changing. In those days, you have missioners that probably don't have much of sound Western education. But today that is changing. We encourage them to preach their sermons in Yoruba, in English, and most importantly also in Hausa, so that our branches in the north can attract more members. Because what is important is that if you are talking and I can't understand what you are saying, there is no point. So we are encouraging our missionaries now to ensure that the relevance to the area in which they are operating, if you are in Igbo land,
speak Igbo. Speak
Igbo to preach your sermons. And that's the dimension we are taking into it now, so that we can have much of other Nigerians to be members of the society.
All right, thank you, Dr. Sani. Because of time, quickly, let's just get to Dr. Yusuf. Now, you're having a 100-year celebration. Where is this happening? Is this still in Lagos? And then what are the activities lined up for?
Thank you very much. The centenary commences about 3 months back. As the president said, we have branches all over the country. The man was in Austin in US, he was in London. The president has traveled to Ogun, Oyo, Osun, Lagos, Lome. That is the Republic of Benin. So the grandfather and I will be having a dialogue in Abuja on Tuesday at international conference centers to do a dialogue of where we invite the...
That's next week Tuesday.
Next week Tuesday. We invite the president and commander-in-chief to be our special guest of honor. The former emir of Kano will be the chairman of the day. After that, then we'll go to Lagos on the 21st, which is the Founders Day, to do the grand final. We're going to give award to those that have been assisting the society and the work of Allah. I think that at the same time again, we open a mosque, a new mosque at the university, and we lay foundations, a summit, Senate building foundations of 2.5 billion, which will be donated to the universities. Those are the things we intend to do for the...
So it's a week-long program?
No, more than a week. We are July.
Since July. Okay.
So we're running it up now with the dialogue here in Abuja on Tuesday. But today we are going to commission a new mosque in Gwarimpa.
Today?
Like Abuja, we have mosque in all the area council. Okay. We have in Bagbalada, we have in Kubwa, we have in Buhari, we have in Matama. So we are commissioning a new one in Gwarimpa today.
And then you mentioned Nigeria University. How many billion?
2.5 billion. Senate building.
Oh, Senate building.
Yeah.
How did you source that money? From members?
Donations from members.
Oh, wow, great.
Okay, let's come to...
the missioner. This society is a big society, I must say. You've talked about what you're doing in the education sector, and then the way you're rounding up your centenary celebration. It shows that you're actually committed to the education sector. But, because you're a faith-based organization, like you've said, what have you done, in terms of passing the right message, to your followers about tolerance, about the values that could keep us as one? And then what are you doing? Because I know that Nigerians, we are drawn to our religions. We hold it dear. So as a society, have you been able to get Nigerians to think about one Nigeria and to tolerate people from other faiths?
We have done much more than we have said. And I'll give you just examples to answer your question. You see, our main masjid, our main mosque in Lagos, the Alakoro Mosque, which is share a fence with the Methodist Church. We share the same fence. So, and no matter how much you preach peaceful coexistence, tolerance, nothing speaks more than actually seeing, in real terms, tolerance. That's number one. Number two, by our policy in educating all without discrimination, we also preach, show example of how to live, harmoniously in spite of our religious differences. And of course, you see, because Yoruba land essentially, you find within the same family people of different faiths. Of course, Ansaruddin has contributed to social cohesion like no other faith-based organization, because whereas we take our faith, our Islam, very, very seriously, of course, we have never, had any conflict, any loggerhead with any other faith in this country. And of course, we have consistently, emphasized to our members that without peace, there will be no development. And without peaceful coexistence, even the practice of our religion itself, various religions, will be impossible.
Without peace, there will be no existence. Without peace, there will be no coexistence. Thank you very much for that message. But I want the last parting shot from the president, Dr. Are Ademola Sani. What message do you have for Nigerians?
Well, first, let me say this. As part of our own contribution for cohesion and understanding between the various faiths, when we do our conference every 3 years, we invite other faith leaders of other faiths to address us at the conference. Okay. The last one we did in Lagos, the CAN chairman in Lagos State came in and addressed us, and that's the policy of the society in order to ensure cohesion and peace between the different religious organizations. Now, the message I have for Nigerians is that, as the missioner have just said, without peace, there can be no development. Okay. We must learn to tolerate each other. We must learn to understand each other. God had made us to come together in this country, knowing that we have different languages. He knows what he's doing. And we can take away